So, the artificial pancreas is an extraordinary thing if you really sort of step back and take a look at it. In 2005, this was a technology that nobody thought was really possible. There was significant debate in the expert community about, was it even possible? Could we take a pump? And could we take a continuous glucose sensor? And could we allow them to talk to each other wirelessly with some kind of a sophisticated communication computer software that would allow the sensor to tell the pump kind of what was going on and make decisions about helping to start automating this very hard, very burdensome reality of living and managing with type 1 diabetes. So what we were really trying to do when we looked at artificial pancreas technology was say, is it possible that we could put some brains into this system? Could we start to create some smarter pumps that could alleviate some of that constant drudgery, that daily burden of living with type 1 diabetes? And when we first started trying to do this, people said it couldn't be done. And JDRF said, well, we're going to do a targeted investment. And through the leadership of some amazing individuals, both on staff and on our volunteer side, we made some very targeted investments. And from that, quickly realized that not only was it possible, but it actually could be done and could work pretty well. So 2006, we got started. By 2007, we were testing these for the first time in human beings. We were able to jump out of the hospital into the real world, and last December, I got to live on the artificial pancreas for 3 days and 2 nights in the real world, where I was able to live and walk around and have a normal life for 3 days, 2 nights on an artificial pancreas. I got to go and have a cheeseburger and fries. I got to go have a hot fudge sundae one night. I really had a good time with this. I really had a lot of fun. When I was sitting there living on the artificial pancreas, I realized that I wasn't having to think about my diabetes. And for me, the cure means not having to think about my diabetes. So this isn't the cure, but it gave me a glimpse of what that world will be like when we don't have type 1 diabetes, and that's the most powerful takeaway from this entire experience. Many of you sitting in this room have been supporting JDRF for many, many years, decades. I really think it's important that we take a minute and sort of step back from this and really appreciate what it is that we've made happen here. JDRF has a plan, we've been executing it, but you've been coming to these events, you've been going to walks, you've been helping to support everything that we do. And it's driving towards an outcome. And now I'm able to sit here in front of you and show you an artificial pancreas that works on a cell phone. You made this happen. To me, it's vitally important that we take a minute and step back and say thank you. Because if you hadn't have done all of the work you've done in those years before, I would not be sitting here today with this. And just as we've done it with this, we're going to do it with any number of other things that JDRF is working on to bring us new therapies that will change the course of this disease in our lives and ultimately lead to a world without type 1 diabetes. JDRF is leading the way, and together we will create a world without type 1 diabetes. Thank you.